In this video, we're going to talk about NAD, what it is, why it's thought to be involved in the aging process, and ways to possibly increase your NAD levels. My name is Dr. David Geier, double board certified orthopedic surgeon, sports medicine specialist, and media medical expert. I help you feel and perform your best regardless of age, injury, or medical history. Please understand, in this video and every other video on my channel and every live stream, I'm not giving you medical advice. This is meant for general information and educational purposes only. Now, what is NAD? This is a hot topic in the health world right now. It stands for nicotinamide adenine dinucleotide. It's required for about 500, maybe more, enzyme reactions throughout the body. It plays key roles in regulating almost every major biological process in our body. But what most people care about it, as far as NAD is concerned, is that it might allow us to lead healthier and longer lives. Again, it controls hundreds of processes throughout our body: energy metabolism, cell survival. It rises and falls depending on food intake, exercise, time of the day, things like that. But NAD levels steadily decline with age, which leads to altered metabolism, increased susceptibility to a number of diseases. It's been shown that restoration of NAD levels in old or diseased animals can promote health and extend lifespan. Now, in our bodies, NAD is in a constant state of being synthesized and degraded and recycled, not just in the cytoplasm of our cell, but all the major organelles of our cells. And where it tends to have most of its effects in the body is in its role on sirtuins. NAD increases or promotes cognitive function, gluconeogenesis in the liver, lipogenesis in adipose tissue, insulin secretion in the pancreas, insulin sensitivity in muscles. It promotes endothelial cell proliferation. It protects against cardiovascular disease, cerebrovascular disease. It's thought to regulate immune function and inflammation, protect against acute injuries of the kidney. It's thought to promote and extend fertility in both males and females. Again, most of those are animal studies, but it's going to be looked at much more in humans as well. So how could we boost our NAD? Again, remember, NAD goes down with age. Well, one way is calorie restriction. Calorie restriction has been shown to extend lifespan and prevent chronic diseases in all kinds of organisms: yeast, worms, mice, rats, monkeys, and it probably does it in humans. The thought is that the calorie restriction increases the levels of NAD within the cells, stimulating sirtuin activity and extending the lifespan of the organisms that it's been studied in. Another way, exercise. I've talked in a live show I do, Better Than Ever Live, how older adults can increase their NAD levels basically to the same levels that people in their 20s to 40s have, just by doing above average amounts of exercise. So exercise, in theory, is an NAD booster as well. And then there are supplements, there are medications that are thought to be NAD boosters as well. And that's really where most of the attention on NAD has been given, is basically by supplementing the NAD precursors. Things like NMN, NR, have been looked at to elevate intracellular NAD levels. They are thought to lead to the synthesis of NAD and then upregulate those sirtuin activities in humans. There was a study that looked at adding NR to your diet. It did increase NAD levels in mammalian cells and in mice tissue, activating SIRT1 and SIRT3. And that basically got rid of some of the metabolic defects seen in obese mice. It boosted their energy expenditure and their oxidative performance of their skeletal muscle and their brown adipose tissue, and basically reversed some of the metabolic impairment. NR supplementation increased the mitochondrial NAD levels, improved mitochondrial function in the older mice, and prevented the accumulation of senescent cells in the muscles of aged mice. Again, that was NR supplementation. Other effects of NAD boosters on your health, whether it's NMN or NR. These are mostly animal studies, but they are worth at least talking about potentially what increasing your NAD levels could do in terms of your health. They've been shown to improve neurodegenerative disorders, metabolic diseases, and age-related complications. So one area, liver function. NAD is very involved in pathways in the liver, so it's very important to have optimal liver function. And in pre-diabetic mice, giving NR, that NAD precursor, improved glucose tolerance, reduced weight gain, reduced liver damage, prevented and reversed non-alcoholic fatty liver disease. Kidney function, reduced levels of NAD as organisms get older and their kidneys get older. You get a decrease in sirtuin activity that's responsible for the reduced kidney function and reduced kidney resilience with age. NAD precursors appear to prevent age-related and toxin-related kidney damage. Muscle function, giving NAD precursors like NR and NMN in mice improved muscle function dramatically. It reversed age-related loss of muscle by increasing mitochondrial function, increased ATP production, reducing inflammation, and switching the muscle fiber type to a more oxidative muscle fiber type. NAD boosters have been shown, again, in animals to be beneficial for cardiac function, vascular function, and endothelial function, which is really important because cardiovascular and cerebrovascular disease are some of the biggest culprits as far as decline in quality of life as we get older, responsible for about 1/3 of deaths. And NAD levels, getting the NAD boosters to improve NAD levels might be very important for heart function and recovery from injury. And so that's being studied. NR and NMN, NAD, these boosters are thought to be, or are being looked at as a potential therapeutic for cardiovascular disease and arrhythmias. They did it in old mice. They showed that NMN restored the dilation of the endothelium in the arteries, basically reducing arterial stiffness. NAD precursors have been looked at for immune function and inflammation, looking at older mice, 24-month-old mice treated with NMN just for a week, reduced their levels of TNF-alpha, tumor necrosis factor alpha, and interleukin-6, big inflammatory cytokines in skeletal muscle. Neuron function, NAD has been shown to be very important to the function and survival of our neurons. And then the one everybody cares about, and that's aging and longevity. It's very, very clear that NAD plays a role in our decline as we get older, and not just humans, but in all animals, all organisms. Now, NMN and other NAD boosters like NR have not been tested for lifespan in humans yet, but mice have. There was one starting mice on NMN at 5 months, administered to them for over a year. The treated mice were more physically active, improved insulin sensitivity, improved lipid profiles, better vision, better bone density, basically gave them health benefits. It reversed some of their age-related decline by giving the NAD boosters starting at 5 months, which would be middle age for us, as a way to prevent aging and age-related physical decline. So that's a lot of information, some very technical. What can we make of all this? Well, again, one, our NAD levels decrease as we get older. It plays a key role in energy metabolism, cell signaling, energy sensing, and reactions through processes throughout the body. And that decline of NAD leads to decreased sirtuin activity, which can lead to metabolic dysfunction and mitochondrial dysfunction. So NAD replacement, whether it's an NAD precursor like NMN or NR, may be a target that we look at for age-related metabolic dysfunction and fixing that. There's a lot we need to learn, but it seems, at least so far based on the animal studies, the NAD boosters are safe and seem to prevent and treat diseases, at least in animal studies. Whether that translates to humans, that's the next big question. The early results in small human clinical trials look good, but there's a long way to go. If we're going to use these NMN or NR NAD boosters, it's going to be very important that we understand their safety profile, how to best deliver them, what's the dose, what biomarkers do we need to follow with lab tests every so often, whether it's better to degrade the breakdown of NAD that we already have or give a booster to synthesize it. There's a lot we need to know, but it really, really is exciting to imagine that taking a pill, basically an NAD booster, might increase our vitality, or might reduce mortality risk and extend our lifespan and extend our health span so that we're feeling and performing better as we get older. If you'd like to read the studies that I mentioned, they should be in the description below this video, links to that. If you like videos like this, you want more information about optimal health and wellness, healing and recovery from orthopedic injuries so you can feel and perform your best regardless of age, injury, or medical history, subscribe to this channel, click the bell to be notified when I start a new live stream or when I release a new video. If you have a tendon, ligament, muscle, joint, arthritis type injury, and you want to see somebody who truly knows about bone and joint injuries in athletes and active people, I'd love to help. I'm a double board certified orthopedic surgeon and sports medicine specialist. I'd love to talk to you about all your options, not just cortisone shots, not just physical therapy, not just surgery, but all sorts of options. So go to my website, drdavidgeier.com. There's a link in the description below. Go to the contact page in the upper right corner of the page. Click that, fill out the form, and we could talk about how you can formally see me as a patient or other ways that we can work together. Thank you so much for watching. Again, I'm Dr. David Geier. I look forward to helping you feel and perform better than ever.